I'm Catherine, and I was diagnosed with IgA vasculitis 21 years ago. And one of the key themes picked out in the social media analysis is of side effects from medications. Some people with chronic kidney disease need to take medications to help control their blood pressure. Some people need to take medications to help with their chronic kidney disease. And some people need to take medications after their transplant as well to make sure that their kidney or kidneys continue to stay healthy. So I'm joined today by John Barratt, who is a doctor and researcher at Leicester. Welcome, John.
Thank you, Catherine.
So John, we know it's really important that patients with IgA nephropathy take medications to control their blood pressure. Why is it so important?
Well, of all the treatments we have available to treat IgA nephropathy, controlling the blood pressure is by far the most effective way to protect the kidney and slow any progressive kidney damage. And that's true for all types of kidney disease, but particularly so for IgA nephropathy. We know from many large studies that the better the blood pressure control, the better the outcome for the kidneys.
So John, we know that it's really beneficial for patients to take blood pressure medications and to control their blood pressure. But sometimes people might experience some side effects. Can you just elaborate on that and how we could potentially deal with them?
Yes, so unfortunately no drug is perfect. And whenever a doctor is prescribing a new tablet, it's really important that we explain to the patient the potential benefit, but also the potential common side effects they might experience. And certainly there are side effects that we can see with blood pressure medications. They vary depending on the type of blood pressure medication. I'm just going to go through the different types, if that's okay.
Yeah,
the most common blood pressure medication we use in IgA nephropathy are those that we call renin-angiotensin system blockers. And these are ACE inhibitors, and you can tell an ACE inhibitor because the name of the drug ends in pril, so ramipril, lisinopril, or angiotensin receptor blocking drugs, and they end in sartan, so losartan, candesartan, valsartan. And the commonest side effects with these drugs are a dry cough, which stops if you stop the drug, but also as you get worse kidney function, they can in fact cause some problems with the salts in your blood, and particularly with potassium. And so when we find people who have quite advanced kidney disease, we have to think about stopping or reducing the dose because the potassium will become elevated, and that potentially has consequences if we're not careful.
Yeah, it can be quite nasty. I had that actually. So I used to take perindopril and I was on it for a very long time. And I ended up in A&E because my potassium was quite high. But I actually had no side effects. I didn't feel it. It just came from some bloods that I had done. So like you said, it's important to monitor.
Yeah, and it is an unusual side effect that occurs only at the advanced stages of kidney disease. But these drugs, these sartans and pril type drugs, are incredibly valuable in treating IgA nephropathy because they control the blood pressure, but they also reduce the amount of protein that leaks into the urine. And that's really important when trying to protect the kidneys in this condition.
Definitely, yes.
So one of the other classes of drugs that we often use are drugs called calcium channel blockers. And these are drugs that end in pene, so amlodipine, nifedipine, lercanidipine. And these are commonly used. And the kind of side effects we would warn our patients about would be swelling of the legs, or flushing, or occasionally headaches. And so these are symptoms that can develop either with a low dose or with a high dose. And the first thing we would do in that situation is just reduce the dose to see whether we can control the blood pressure and minimize the side effects.
I was just going to say, so yeah, I used to take amlodipine and I suffered with that. So it would make my legs swell and really, really hot to touch, But like you say, I just spoke with my doctor about it and I got switched to another one and was absolutely fine with that. So I've been very lucky with side effects with the medications that I've
Yeah,
taken?
at least so when we treat blood pressure, there are a number of different types of drugs available. And if one of those doesn't suit the patient, then the doctor will often try a different class of tablets, because the priority really is to control the blood pressure in IgA nephropathy. So I've mentioned the RAS blockers, I've mentioned the calcium channel blockers. There are also beta blockers that we occasionally use to treat blood pressure. And those tablets are good at treating blood pressure, but they can slow the heart rate down and they can make people feel less energetic and tired. So those are side effects that we would look out for, and we may well need to reduce the dose if that was found. The other type of drug we use are alpha blockers, and these are drugs like doxazosin. And again, these are very effective at controlling blood pressure, but they can cause problems with dizziness. And that's the same for all the blood pressure medications. If we control your blood pressure so well that your blood pressure actually falls below the level that we want, then actually you can notice dizziness. And you might notice it either when you're doing things, exercising, or even when you're sitting down and then standing up. And that's something we always ask our patients about, because that's a good sign that we've actually over-treated and we need to think about reducing the dose of blood pressure tablets.
Yeah, I can definitely relate to that. So I did used to take doxazosin as well. And yeah, I do remember getting up off the floor and feeling a bit lightheaded and things. So, but as you say, it's, you know, it's easy to work around and to find other medications or to lower the dose.
That's right. And one of the things I encourage my patients to do is to get themselves a blood pressure monitor.
Yeah.
Again, reinforcing how important it is to control blood pressure in IgA nephropathy. And if you're able to keep a diary of your blood pressure once or twice a week, then that's really useful for me as your doctor to look at, to make sure your blood pressure is well controlled throughout the week and over different times during the day. Because again, that's something that helps me determine whether I got you on too much tablets or too little tablets. Because we don't want our patients having side effects, because if you have side effects, you're less inclined to take the tablets that we've prescribed for you.
Definitely. And I think it's good as well to possibly have a blood pressure machine at home, because then you can take ownership of, you know, of your health. And like you say, it's so important to bring that along, you know, to any appointments that you have with your doctor, so that they can see exactly what's going on when you're in your home environment.
No, absolutely. And often if we're just starting out on blood pressure medications, it's very easy for the patient to keep a record of their blood pressures. Then just give me a call, tell me how the blood pressures are doing, so we don't waste their time coming into hospital. We can manage this remotely by adjusting the dose according to the medications. You're quite right. This is a condition that affects young people. And I think people want to take ownership of their disease and they want to regain some element of control. And managing your own blood pressure, understanding how the tablets are working, and ensuring you've got that target blood pressure is key to that.
So it was picked up on social media that some patients have said that if they're experiencing side effects such as dizziness, to take their blood pressure medication in the evening rather than the morning. Would you say that's a good thing to do, or would you advise that?
So it's certainly something we do advise patients, that if they're noticing that their blood pressure is low and they're feeling dizzy during the morning, particularly if they've taken all their tablets at the same time, that actually spreading their tablets out and taking their blood pressure medications in the early evening or before they go to bed may well reduce that symptom. It's very individual specific, and it's worth chatting to your doctor about whether that's something they would advise, but it's certainly something that I do regularly to try and improve the patient's quality of life and to prevent them from feeling dizzy.
Thank you, John. That was really useful. So another thing that was noted on our social media analysis is that people take steroids, and some people are saying that they get side effects from these. What are the sort of side effects that people may have from taking steroids?
Okay, so yes, steroids are used in some cases to treat IgA nephropathy. And the steroids we're talking about are drugs like prednisolone or prednisone, methylprednisolone. And these are used to treat a number of different diseases, not just kidney disease. And the pattern of side effects we see are very common across all types of disease. And the kind of things that people notice are an increase in appetite and weight gain. They notice that they're not able to sleep as well. They might be a little bit more on edge. They might have a little bit of a tremor. They do gain weight in a particular way. They gain weight in their tummy and around their face. And they may notice that their muscles are less strong. in particularly the muscles we use to get up and out of a chair or to climb the stairs. The other things that we as doctors think about if someone is on steroids is whether their blood sugars are normal, because being on steroids can alter your blood sugars and potentially make you at risk of diabetes. They can actually increase your blood pressure as well. And if they're taken for a significant period of time, they can cause problems with your bones and make your bones weak. So there are obvious side effects that you would notice as a patient, and then there are side effects that we look for as doctors that are not necessarily noticeable to you, but are things that we would test for in the clinic to ensure that you weren't developing those kind of side effects that ultimately might mean we need to stop the treatment.
Yeah, so if people are at all worried about taking steroids, it's best to speak to their doctor, isn't it?
Well, I think it's really important that whenever anyone who is going to be treated with IgA nephropathy with steroids has a full and frank discussion with their kidney doctor about the potential benefits for them and about the potential side effects that they might experience and what they might mean for them in terms of their general quality of life, but also the kind of things that might affect them for years to come. The other thing I didn't mention, which has become apparent in some of the clinical trials that are currently ongoing, is that there is an increased risk of infections with high-dose steroids. And so we will obviously want to warn patients that if they do pick up an infection, we need to be very careful, because their immune system is not as good at fighting that infection as it would have been without the steroids.
So on social media, it would appear that some people are for taking steroids, some people are against taking steroids due to side effects. Is there a straightforward answer?
There isn't, I'm afraid. It's very much a decision between the doctor and the patient. It's a very complex discussion, and the data upon which we base that discussion is very difficult to interpret at the moment. And we're going to cover that and the pros and cons of taking steroids in IgA nephropathy in another video.
Thank you, John. That was really helpful. So we know that steroids are used to suppress the immune system, but obviously they're not the only medication to do that. Could you just tell us a bit more about other ones and if they have the same side effects that steroids do?
Yes, so a number of different types of immune suppression tablets have been tried in IgA nephropathy to variable effect, and they all come with their own range of side effects. And we're going to discuss in another video the pros and cons of those drugs in treating IgA nephropathy and whether they're useful and what potentially might be coming on the horizon that may be available to treat IgA nephropathy in the future.
So another thing we just wanted to talk about today was swelling. A lot of people report experiencing swelling with IgA nephropathy. Is that something possibly caused by the medication or the illness itself, and how can that be managed?
So yes, swelling is a common feature in many forms of kidney disease. We've already mentioned that the drugs, the calcium channel blockers, amlodipine, lercanidipine, can be associated with swelling, and you mentioned yourself that you'd suffered with that. Yeah. And actually this reverses when you stop the medication, so it's a temporary phenomenon. As the kidney function gets worse, however, the kidneys get less able to get rid of the salt and water from the body, and that excess salt and water builds up in the body and essentially goes wherever gravity sends it. So if you're up on your feet all day, you notice that salt and water in your legs, and if you're in bed all night, then that fluid moves from the ankles and ends up around your tummy. And so this is a feature of kidneys that are really not working very well, and is a feature of more advanced kidney failure, irrespective of the cause. And so what this essentially means when you see that your legs are swelling is that you've got too much salt and water in the body. And the way we treat that is we try and reduce the salt intake, and you're going to hear from one of our dietitians who's going to talk about sodium restriction or salt restriction in one of the other videos. We try and manage how much you drink, and we can encourage the kidneys to pass out more salt and water by giving you tablets called diuretics. And these drugs are drugs like furosemide, bumetanide, or bendrofluozide. And these drugs, as I say, give the kidney almost a little push and help them pee out the extra sodium and water that the body's accumulating. And so by balancing the amount you drink the amount of salt you eat, along with helping the kidneys get rid of the excess salt and water with these tablets, we can control that swelling and hopefully in most cases get rid of it completely.
Yeah, I can definitely relate to that. So for probably about a year before my transplant, I would wake up in the morning and be absolutely fine. But within an hour, a couple of hours, I could feel that my legs were starting to swell and my feet were starting to swell. And yeah, it really wasn't very nice at all.
No, it can be very uncomfortable, particularly if you're up on your feet all the time.
Yeah.
So one of the things that we often will ask our patients to do is to weigh themselves every day, because any change in weight day by day is essentially driven by retention of salt and water. Yeah. And you will be amazed at how much salt and water patients can retain before they reach the point of going to see a doctor. It can be 5-10 kilograms of salt and water. And it takes a little while to get rid of that. So if patients do notice that their ankles are swelling, then it's very important to make sure their doctor knows about it so that they can look at that in the context of how the kidneys are working and the combination of tablets that you're taking to see whether any adjustments need to be made.
Yeah, and you talked about managing your fluid intake as well, didn't you? So I could drink a litre. I was on a litre fluid restriction, which isn't too bad. Some people are on a lot lower, but obviously that's something to talk to your doctor about. It
is, and it's very challenging. And we're not blessed with too many hot days in the UK, let's be fair. But on a hot day, it can be particularly challenging. A cup of tea is 250 mils. So that's 4 cups of tea all day, nothing extra to drink. So little tricks are sucking ice cubes, or boiled sweets, or if you're diabetic boiled sweets, just to keep the mouth fresh, or having half a cup of tea twice as often.
Yeah.
But it is a real challenge to keep the fluid restriction while feeling thirsty. And the thirst is often driven by the salt in our food. And if we can control the salt, then the thirst will follow and you will be less thirsty if we can manage both things simultaneously.
Yeah. Thank you so much, John, for joining us today. And there we are. So I hope you found that really useful. We've talked today about side effects from blood pressure medications, medications that suppress the immune system, steroids, and I hope it's all been very useful for you. If you do need any more information, you can go to the Kidney Care UK website. Thank you very much for joining us.